Welcome to my live. Okay, I'm gonna go ahead and start with the poll. Where are you from? Welcome page. And I'm gonna put Facebook. I'm gonna put YouTube first. YouTube or Facebook. All right, let me go ahead and also share this live. So when y'all come through, say hello, and I will be right back. Right, y'all, I'm back. Okay, so let's go ahead and get started. I'll wait for a minute
Hello,
so y'all
hello,
can start coming
everybody, and
in and
welcome to
everything.
this week's
Let's
class.
see.
I will be.
All right. If you are new here, say new. Hey, Sheila, what's up? If you are new here, say hello. Let me know where you're from. Go ahead and do at the very bottom, do the poll. Let me know where you're from. Where are you from? Are you from YouTube or you are from Facebook? Which one are y'all from? Okay. We're gonna see how many people are gonna come through. We're gonna see. So we started talking about the pelvic floor. I did a class on this before, actually. Let me spin it around. All right. So this is one of my classes that I taught before. We're gonna wait for some more of the people to come in. Let's see how the traffic gonna be. But the more that I keep coming on, the more people keep jumping on, which is really, really good. Okay. And I don't want to start it completely over.
Hello, hello,
But let me
everybody,
let y'all
and
watch.
welcome to this week's class. I will be discussing the pelvic floor muscles. I got some good information for you that I want to share,
The
and you're
pelvic
gonna be
floor.
really impressed. I did a lot of kind of investigation, and I got some good information to share with you.
I need my hair back like
Come on
this.
in. This is gonna be maybe a little bit lengthy class because I have a lot of information, and then of course we're gonna do the juicing after that. All right, but yeah, let's start, y'all. Welcome to my class.
All right. So that's like the introduction, okay? So I guess I'll go ahead and start over just in case some people missed it. So I guess it's like almost like like once every 2 weeks. Then I started doing it like once a month. Okay. So the pelvic floor, does anybody know what the pelvic floor is? Okay. If you're coming in, say hello. Go ahead and take the poll at the bottom. Let me know if you are from Facebook or if you are from YouTube. That way I can kind of know where the traffic coming from. Okay. So we already hit the 500 goal. We already hit the 500 goal. Y'all, I think if y'all got animations and stuff and y'all can send it, y'all can send it. Because a girl in the live yesterday, she was sending like some little animations. Like, I don't know. It probably was like emojis or something. But anyway, oh, I hope this not hanging up. Please tell me it's not hanging up. Oh, damn. Oh, okay. I can cut the camera on and I can cut it off. I didn't know that. I'm trying to learn. I'm trying to learn YouTube do it over here. All right. If you haven't taken the poll, go down to the bottom. I see a few people up in here right now. Let's see if it's still connected to my net, please. Yeah, it's still connected. Okay. All right. I guess it'll be okay, y'all. Give me another second so I can show y'all what I'm doing. No, we doing them kind of questions. I'm doing a class, okay? If it's not related to the class, then don't even ask, all right? Yeah. Let me go ahead and hide you. Whoever you are. Whoever you are, let me go ahead and hide you. So let me tell y'all one thing about me. One thing about me, when I'm serious and I'm doing my business and I'm showing y'all stuff, thank you for the compliment. Let me see. You know what I'm saying? I'm serious about my work and I do not like people to jump on my live and play. Okay. If I see you playing, I can tell from the jump if you coming in here to play or if you coming in here to learn. So FYI, don't come in here with that shit. Okay. So let's go ahead and go back to the class. All right. All right. So the pelvic floor is what we're going to be talking about today. And if you know about the pelvic floor, can you say yes? If you have not subscribed, if you have not well, yeah, if you have not subscribed, please subscribe. She don't play for real. Sheila, I'm gonna have to make you one of my moderators so you can get the crazy people out, okay? I'm gonna put you as a moderator. I just added you as a moderator, so you can actually okay. So yeah, you like a standard moderator, okay? Because you already know I know you, so I know you'll look out. So if you see anybody crazy, anybody saying craziness, when I know people, I know them. You can tell that I know them. But if they saying stuff like how that person just said, like crazy stuff, go ahead and block them. I've given them that Louisiana flavor. I know, right? Don't begging about Louisiana now. Come on now. Come on now. Let's see. You coming to class today, gonna learn about the pelvic floor. Hello, everybody. Come on in. Subscribe to my channel. You learn a lot over here, okay? Not only do I make natural organic products, I also do classes. I'm a nutritional coach or a holistic coach, whichever one you call me. They pretty similar, right? So whenever you come here, you're gonna be learning different things, okay? And also, if you want to schedule consultation, which is the reason why I'm doing a lot of these recaps of these classes, you can book me. My services are $85. Well, the special right now for a 1 hour consultation, you can pick whatever subject you want to, okay? You can pick whatever subject you want to. Right now it's $85, but my normal price is $100 for a 1 full hour consultation, okay? I'm going to tell you everything you need to do, what herbs you need to start incorporating in your diet, what type of foods, what type of organic juices you need to drink. I'm gonna do your consultation tailored to what you need, okay? So it will keep you on the right path of staying healthy. You're gonna start seeing better numbers on your test results, on your lab results, okay? So if you have like diabetes, you have hypertension, you have thyroid issues, you suffer from depression, anxiety, all of that, okay? So that's what I am here for. Good morning. Hi, Princess. Good morning. All right. I'm also going to be posting links. So if you want to book a consultation or if you want to purchase any of my digital marketing tools, okay, then you can. All right, y'all. Let me see if I can. Let me see if I can actually share it for y'all. Let me see. Let me go to Facebook so I can copy my link because I'll be forgetting. So I'm starting to see more people here, the same people starting to come in, which mean that y'all starting to get used to me. So that's good. Facebook, you know your normal people. Now I would be on two phones, but I don't really feel like it. I don't really feel like being on two phones right now. So let's see. Uh, I'm going to copy a link. I'm going to post it in the chat so that y'all can see. Here we go. There we go. I did change up the look of my store a little bit. This is my stand store, and this is you can buy all your products. If you have not had a chance to get what you need, you can go there and get everything you need. I also have a free recipe, okay, that I did put on there. You do have to put your information, okay? You do have to put your email. You do got to put your name, okay, and it will send it to you. But let me go to my view your channel. Okay, let's see. Let's see if it okay, here you go. Okay, so I'm on my live right now, and what I'm gonna do is I'm gonna put this link in the chat.
Right now, and what I'm gonna do is I'm gonna put this link in the chat.
Boom. So can y'all see it yet? Y'all see the yellow? I just posted from my computer. Okay, I'm
Y'all
gonna
see the yellow? I just posted from my computer. Okay, I'm gonna.
let me go ahead and pin this. All right. Well, if it let me.
Let me go ahead and pin this.
Let
All
me
right.
see.
Well, if it let
I
me.
don't know if it's gonna let me do it on here.
Well, if it let me.
Okay, it may not let me pin it, but that is the link.
Okay,
Okay,
it may not let
everybody.
me pin it, but
That
that
is to the link to where you can purchase all digital market things. I'll show you really quickly of what things I have, and then I'm gonna continue talking about the pelvic floor. Okay, so if you are new, say hello. Actually, on my other phone, I'm on my other iPhone. My other one is charging. Let me show y'all. All right. So I showed y'all this yesterday. This is for all the new people who was not here yesterday. This is my stand store. So if you see the link at the bottom right here in the chat, that's where you're going to go to get this information. Okay. Click on that link. It's going to take you here to my stand store. All right. You're going to see Yo Digital Boss. All right. Now, if you go right here, you're going to see get my free detox recipe. This is absolutely free. Okay, y'all. So once you go to the link that's right here in the chat, you're going to put your name, you're going to put your email, and submit and download. It is going to send you that information, okay? Now, if you want to support my small business, you can also purchase my holistic juicing ebook, and it also has a bonus herbal list, okay? So yes, it do have a bonus herbal list available. Hold on, y'all. Let me put it on mute so it won't sound like I'm echoing, okay? Because I have my computer on here, all right? All right, so let's see. And this is for all the new people, okay? That wasn't here yesterday. If you was here yesterday, then you already heard me talk about this. I'm gonna always promote it because it's a part of my. So if you have not downloaded, go ahead and click the link, and you can download and you can purchase what you like. So the juicing ebook has a lot of different recipes in there that's good for your health. It's good for inflammation, and it's also good for detox your body. All right, that one is $9.99, which is right here at the bottom. And then we're gonna go up right here. This is my herbal list that I actually made. Okay, special promotion. This one is $8.99. So this list is give you a list of different herbs, even herbs that you may not haven't even heard of before. All right, so you can download that. Once you pay for it, it's going to send you an email, and then you put it on your computer, your tablet, or your cell phone and download it instantly. All of this stuff here is instant. You're going to get it right away after you pay for it. Okay, now this is my full nutritional course. I have tailored a whole nutritional course for your learning. Okay, if you want to get better with your health and just wanted to get better, you want to have better results from your blood work for whatever chronic diagnosis you have, and you just are, if you just love to learn and you want to learn more about nutrition, this is a very, very good course. It's on for 50. The regular price is 60. Okay, you're gonna have a lot of interactive videos up in there. It's an amazing course, okay? Um, it's gonna kind of tell you some things here, but once you put, your information, your name, your email, make sure your email is always correct, and you pay for it. It's gonna automatically send you this full digital course. Okay, you're gonna get it to your email, and then you can start learning on your timing. Okay, so as you going through the course, you can learn on your own timing. So it's not a specific amount of time, like or that you got to use it. Once you purchase these any digital stuff from me, it's yours to keep. You don't have to give it back. All right, it's yours. You pay for it. It's yours. Put it on whichever computer, tablet, cell phone you want. You can put it on all three if you really want to. It's your personal file that you purchased. Okay. Now also, y'all know I do the nutritional coaching one-on-one sessions. Okay, and that is pretty much the main reason why I come here and and hopefully if it's something that's going on in your life more on, okay. And then also I'm trying to build my platform here with different people. People know me from Facebook already, but I want a different crowd of people, okay. It's okay if my Facebook crew follow me here because I do have people that like what I do, okay. But I really want to reach out to people that is my page. Okay. So if you are new to my page and you love everything to do with holistic nutrition, page, okay? Because you're gonna learn a whole. Now let me show y'all the one-on-one coaching. This is another something else that I offer. Okay, I've actually done coaching sessions before, and I really like it. So when you go to the link that's here in the chat, I'm just gonna touch it, and so y'all can see. All right. You're gonna see this, all right? And when you go here, it will tell you about my experience. So my background is medical, over 20 years as a medical assistant in different areas. I'm a holistic nutritional coach. Okay, I've worked in so many different areas, and I can guide you on the right path that you need to go, either to shed some pounds, to see better results in your lab results, to feel more healthy in general without taking all of that medicine. Now, if your doctor prescribe medication for you, always follow the directions of your doctor. I'm not a doctor. I cannot tell you to stop taking things, okay? Now, if you feel like it's not working and you just want to, try a whole different approach, then that's when I say come to me. Okay? Because everything I do is going to be natural and organic and better for you because it's no harmful chemicals or nothing like that. Okay? I do recommend different type of supplements depending on your diagnosis, but all of that is discussed when you schedule a one-on-one session with me. Okay? Now, when you schedule your one-on-one session with me, the link is in the bio, is in the chat. You're gonna choose what date you want to come in. Okay, so say you want to do the 20th. You pick the 20th, and then as you can see all the times right here, I think I'm stopping at 6:30. I'm starting. I don't want to start like too early. Maybe about 10. Say you want to come in at 10. All right. There you go. You got your date. You got your time. February the 20th, 10 o'clock. You're gonna put your name. Okay, right here. Will y'all see this message right here? This is where I want y'all to put. This is where I want y'all to put what topic of discussion that you are coming to see me for. If you are coming to see me for hypertension, it has to be one chronic issue because the whole session is going to be tailored to your hypertension. Okay. If it's anxiety, if it's depression, if it's grieving, it could be any type of medical subject, okay, that you may be experiencing. This is where you will enter what it is you are coming to me for. You got the price right here, which is a special right now, 85 for a limited time, regular $100, and then you do book a call. Okay. I like to do video chat. But if you don't want to do video chat, you can also do book a call. And all of this can be discussed over the phone, okay? Now me, I'm more of a I like for things to seem real, okay? So I know with video chat it can seem like more real to me. But if you don't want to do video, you don't have to do a video chat. We can just do book a call, okay? I'm just gonna put book a call and see what they say. I'm just trying to test it out. So you actually got to pay first and then it's going to book the call. Okay. Of course, you got to go through all of that to get to the very ending. Okay. But yeah, this is what I do. This is my digital marketing. So I have a lot of good information. So I'm going to recap real quick. Don't forget, when you click this link in the chat, make sure you go get your free recipe for my detox recipe. That is going to be one of my recipes that's in my holistic juicing ebook. This is the newest thing I think that I did. Yeah, besides like my cookbook and my juicing journal. All right. And if you like that recipe, I'm going to say go ahead and get the entire thing. It's only $9.99, okay? You click that, you download it instantly. It's going to go to your email and just put it wherever you want, okay? You can get your herbalist. You can book a nutritional course, which is all digital, which is a series of videos and information that it gives you tailored to explaining everything about nutrition, micronutrients, macronutrients, like all of that, right? You can also book coaching session with me, which is going to be right here, right now on sale for $85 for 1 full hour. So you're going to have 1 full hour of my time tailored just for you or whatever you need, okay? And this is going to help you to have clarity. of how to take care of yourself better, okay? Eating better fruits, eating better vegetables, knowing which fruits and vegetables to eat, knowing what supplements you can incorporate depending on your diagnosis from your doctor. Like, I'm here to guide you with all of that, okay, y'all? All right. If you agree with that and if you like what I'm saying, tap the screen or say okay. If you're interested in any one of these, let me okay. Now, if you don't purchase anything now, it's fine. You can still get your free uh detox recipe. Okay. So if you don't get nothing else right now, go ahead and get your free detox recipe, okay? And all you have to do is click the link that's right here in the chat. It's going to take you straight there. This is how I'm doing it, okay? Since I can't really post nothing on YouTube just yet, I have to get my numbers up. All right, let's see what's next. I'm going to go back to the pelvic floor. All right, tap, tap, tap the screen. I'm going to share this live with Facebook again. Give me 1 second, everybody. Y'all for holding. All right, I'm going to turn this around. Y'all for holding. All right, I'm going to turn this around. All right. So going back to the pelvic floor, I really want to finish this, but I wanted y'all to know what that link was for. Okay, so let's go from the beginning, which we already went through the beginning. Okay, let's turn this up so y'all can hear. So, view of the pelvic floor. If you know what the pelvic floor is, say yes. If you don't know what the pelvic floor is, say no. Okay? This is your pubic bone right here. All right? This is your transverse abdominis. Okay? The pelvic floor is right here at the very bottom, like where the vagina is, okay? That's the pelvic bone right there. That's what they check for a lot when you're pregnant and you go into the doctor and you go get your checkups. Doctor know where your pelvic bone is at. They know where everything is at, okay? They know the body by heart. All right. If you look at this picture, the pelvic floor holds all of your organs located at the base, okay? Close to the anus, which we know what the anus is, and also the urethra, which is part of the urinary tract system, right? Okay. Hello, hello. Hey, Miss Lauren, how you doing? All right. So, yes, that's what the pelvic floor does, okay? All right, let's keep going. I started it, but I'm going to go ahead and keep going. All right. Problems with a weak pelvic floor. Now, how do you know if you have a weak pelvic floor? I'm going to show you the signs of a weak pelvic floor so you can be aware if you have any of those issues. All right. This is a normal bladder. All right. It says the trusor muscle. It says contracting, right? You see the vibration, right? When the bladder is full, you get this sensation, right? It just feels like you got to use the restroom really bad, all right? And this is when you have an overactive bladder, okay? So you may not, you may not be able, you may start having that feeling or that sensation that you have to go to the restroom pretty frequently if you have an overactive bladder, okay? Now everybody kind of go through that every blue moon. It depends on, depends on what you're doing, how's your urinary system and everything, how's it operating, the things you eat and all of that, okay? So normal bladder, overactive bladder, okay? Which is all a part of what? Incontinence, a weak pelvic floor. That's why you have an overactive bladder. It's because your pelvic floor is weak. That's one of the reasons, okay? Everybody that's coming through, if you see the here in the chat, go there and check out my digital products. You can book your consultations and everything there. You can also download a free recipe there as well. Make sure y'all go grab that. All right. Hold on. Give me a second. Give me a second, y'all. I'm going to cut the camera off for a second. Give me a second. Okay. All right. I'm back. I'm back. I'm back. Okay, y'all, I'm back. Thank y'all so much for holding. All right, so symptoms of incontinence. Okay, so I kind of like these little pictures. The lady had an accident right here. Uh-oh, she really had an accident right here. Symptoms of urinary incontinence. Sweating. Oh, it looks like she's straining. This one is coughing. Sometimes when you cough, you may not have control of your bladder. It may leak a little bit. Okay, so these are just different scenarios of how you can have, uh, weak pelvic floor. All right, possible risk factors of urinary incontinence. Let me show you. Now, pregnancy or childbirth can cause you to have urinary incontinence, okay? Overweight or obese, sometimes they put more pressure in that area, and that's why you feel like you have to constantly use the restroom and things of that nature, okay? Not all the time, but sometimes. Old age, of course, when you get older, your body starts to change, or approaching menopause. If you are going through menopause, you can start having some of these issues as well. If you have a family history of urinary incontinence, those are just some risk factors. Obstruction or blockage. You do not want to have obstruction or a blockage in your urinary tract system. It is very painful. I've seen someone go through this, and someone close to me that actually went through that, and it is horrible, and it caused a lot of pain, and you have to release urine. You have to be able to do number two. You got to be able to have bowel movements. That's all a part of your whole body working properly, okay? Chronic constipation. If you suffer with constipation a lot, that's also a possible risk factor, okay? Hysterectomy surgery, that can also be a cause of just giving y'all a few examples. If you in here, tap the screen, make sure you participate. If you have any questions, also, if you have any questions, feel free to ask me anything regarding what I am showing you, okay? If it's not what I'm showing you, don't ask, because this is like a class, okay? So this is here. I'm here for your learning. I'm here to kind of educate a little bit. These are all classes that I taught that people have actually paid to come to my classes for. However, I keep everything. Every class I do, I document. This is timing. I do this. I study for like 2 hours before I do my classes. Very 3 years, okay? So a lot of people used to come to my classes. A nice number of people used to come to my classes, and in the beginning, it was the best. At the very, very beginning, that's when it was really, really good, because some of my food friends are no longer living. So, of course, with time, things just kind of start changing. The people that's really, really supportive and things like that. All right, so I'm going to show you what a prolapse of a uterus look, okay? Tap the screen. If you're just coming in, go ahead and vote at the very bottom. I want to see where most of the people here are coming from. I can see y'all pictures over here in the chat, okay? If you want to purchase my digital products, all you got to do is, let me see. All you got to do is click the link that's right here in the chat if you want to purchase products. And make sure you grab the free recipe, all right? Let's see. Prolapse of a uterus. Okay, so this is the inside of the uterus, ladies. This is how it looks. See how the cervix is coming down? The cervix is coming. This happens sometimes when you have a lot of kids. I've seen this, like I used to work in OBGYN. I've seen doctors, examine women where they're normal. I've seen a doctor examine women that had more feminine issues. This is a prolapse uterus. Sometimes they have to wear this donut on the inside to push that cervix back inside. Okay, it should not be coming out this way. Okay, so it has to have something to hold it up. But having a lot of kids can cause this. It can just happen naturally. Okay, but I know for sure it was an Indian lady. She had a lot of kids, and she had to wear that donut all the way up inside to keep her cervix inside. So that is called a prolapse of the uterus. So this is normal, and this is a prolapse, okay? If you have any questions about that, let me know. Now, there are different gradings, okay? So that's like a prolapse, right? So you got the uterus right here. That's your big organ. That's the uterus. You got the fallopian tubes. The cervix is usually shaped like a donut right in the front. that's like, stopping like the entrance or whatever, right? The level of the intro is so introitus, okay? So as you can see how the uterus is falling down, it's slowly falling down. So it has different grading systems. This is called grading, okay? So this is pretty much what the doctor kind of do when he examine you. That's what they go to school for. They got to know a lot of information. And this is the grading, okay? Devices and Kegels for pelvic floor. So if you did not know, you can purchase devices to help you if you have a weak pelvic floor. What is a pelvic floor biofeedback therapy? I'm gonna tell you about that. All right. So pelvic floor biofeedback therapy is a type of physical therapy that can help men and women to learn how to contract and relax the pelvic floor muscles. It can be useful for patients who have bladder or bowel incontinence, urination caused by abdominal pelvic muscle contractions, and pelvic floor dysfunction. All right. Patients usually spend 3 sessions a week for 1 to 2 months with a therapist who is specially trained in pelvic floor therapy. Okay. If you're just coming through, say hello. Check out the link in the chat, everybody, and you can see my all of my products there, my digital marketing products. If you haven't purchased it, or if you want to purchase it, that's where you would go to book consultations as well. All right, so here's a patient right here. She's in physical therapy and she's doing some pelvic floor exercises with her. As you see, she has the ball inside her inner thigh and she's probably just pressing it together with her legs, right? Or with her thighs. All right, so yes, if you didn't know, there are devices that you can actually purchase to help you with if you have a weak pelvic floor, okay? This kind of look like when you get an ultrasound and you go to the doctor with not the ultrasound, but when they listen to the baby's heartbeat, that's what this look like a Doppler, okay? But anyway, this will be inserted on the inside of the vagina. Okay? And I'm not for sure what it does. I never used one before, but I think it may do vibrations to help strengthen your pelvic floor, okay? But anyway, it should come with instructions, okay? You can buy these on Amazon. This is another one. This is like an exercising type of equipment that you can use. And see the lady here in the demonstration, she's having it inside of her inner thigh and she's probably pressing her legs together to also strengthen her pelvic floor, okay? So those are two devices that you can use, you can purchase on Amazon, all right? Now, they also have these, okay? These are vaginal weights. Never used that before either, okay? And pelvic floor exerciser. 30 minutes a day in just a few short weeks, you will feel the difference of your pelvic floor. It will be a lot stronger, okay? You have this one weighs 46 grams, 58 grams, and then you have one that weighs 80 grams. And I'm assuming this part right here is going to be inserted inside of the vagina, okay? All right, Kegel exercise effectively prevents issues with incontinence, okay? So, yes, Kegel exercises can effectively prevent issues with incontinence. So, if you do those type of exercises, you may see a difference if you continue doing it, okay? Pelvic floor strong reviews. All right, so these are just some demonstrations of what you can do. This is one right here. Short squeezes, lie, stand, or sit with your knees slightly apart. Quickly squeeze pelvic muscle around your rectum and vagina. Hold it for 2 seconds and release. You can do that right now. If you know how your body operates, okay? Have you ever just squeezed like the vaginal area, like squeeze it and then you release it and you feel it? Like do it right now, right? Squeeze, squeeze, squeeze real tight and then release it. Squeeze your vagina like real tight with your muscles, okay? Squeeze it and let go, all right? Floor. If you can feel that, you're going to squeeze it and then let it go. Squeeze it, let it go. That's like an exercise. And you can feel, I can feel that my pelvic floor is a little weak, okay? Squeeze it and then let it go. How do you know? It's just like when you just a scenario. When you have sex, a man knows when you squeeze your pelvic floor and you release it. He can feel that. Why can he feel that? Because it is a muscle. And when you are having intercourse, it's going to squeeze his private area inside of you. That is a part of the pelvic floor. It is a muscle and they can feel it. Okay. It's like you having control of your body. All right. I just wanted to give y'all a better example because I know y'all probably may have experienced that. Pelvic lift. Okay. This is a pelvic lift where you just kind of like Pilates a little bit. You're laying flat on your back. And then you're going to lift up and then you're going to lift down. You're going to lift up and then you're going to lift down. Okay. And you can do that for maybe like 20, 25 times. Maybe you could do it more if you feel like you want to do it more. And if you feel comfortable. Now, if you're not able to lay flat like on the floor, you can do this on your bed. Okay. If you have back issues. All right, fruits and veggies to strengthen the pelvic floor. All right, so as we know, I am a holistic coach. So I try to tell you natural things that you can do to increase your health and to help it get better. Okay, you don't know, well, people know, but they don't care because food is, we tend to like the food that's not good for us more than the food that is more healthier and have more nutritional value. Okay. But if you start researching more about different fruits and vegetables, I'm quite sure that you will respond differently and you will want to try new things. I like to try new fruits and I like to juice different kind of fruits. I've done that in my juicing class many times. But whatever diagnosis you have, that's part of my consultation. Gonna be, the consultation is gonna be tailored just for you. It's like I'm studying you, okay? Even before I do your consultation, I'm gonna study you, and with the information you're giving me, okay, of your diagnosis, I'm gonna get down to get your symptoms, okay? What type of things you're doing. It is a series of questions I gotta ask you to get down to it, okay? Just like kind of like you going to the doctor. When you go in, they do like a little interview before the doctor comes in. I'm going to get a preview of what issues you're having so that I can help you better. All right. So let's go. All right. Fruits and vegetables. Ooh, they look good. Got some salmon, got some broccoli, walnuts, avocados. I eat a lot of avocados. I love avocado toast in the morning. Bananas. Okay, what are some health benefits of bananas? I always keep bananas. If I do not keep any of the fruit in here, I'm going to keep some bananas, okay? And let me tell you why. You can have an empty stomach, and when you eat a banana, it's going to instantly give you energy, okay? It's going to keep you regular. It reduces your blood pressure and the risk of heart disease. It says scavenge harmful oxygen free radicals in your body. It's going to reduce menstrual cramps. So ladies, when you're on your cycle and you cramping, you can eat a banana that can kind of reduce your cramping, okay? It contains antioxidants, vitamins, and minerals. It helps to grow strong bones. It powers the brain. Awesome. Good for your cognitive thinking. It helps prevent ulcers, reduces depression. Okay. What to eat for a healthy pelvic floor? So if you want to have a strong pelvic floor, these are some things you can do. Okay. It says pelvic floor dream team, pure water, low acidic fruits like apricots, bananas, and melons. Omega-3 fatty acids, caffeine-free herbal teas, or you can also drink like a caffeine-free coffee. You know, everybody drink coffee because of the caffeine, right? But yeah, you can still get coffee that may not have as much caffeine or less, or may not have no caffeine. Okay, now pelvic floor folds. So these things that's gonna aggravate floor more. Does anybody have any questions? If you do, let me know. We've been live for about 40 minutes. I am teaching about the pelvic floor. If you are just joining, please go ahead and let me know if you're from Facebook or if you are from YouTube, okay? If you drink caffeinated beverages, that can aggravate your pelvic floor. Carbonated beverages, acidic fruits like tomatoes, and I love tomatoes. Cranberries, don't eat a lot of those. Oranges, I like oranges. Spicy foods, that can be me a little bit. Artificial sweeteners like aspartame and sectarine, never heard of that. Alcohol also can aggravate the pelvic floor, okay? As you can see on this side is more healthier, on this side is less healthier. So these are the things you want to incorporate more. These are the things you want to do less of. Less caffeinated beverages, less carbonated beverages, less of eating spicy foods, okay? Less of eating artificial sweeteners, okay? Let's see. Is that the end of my slideshow? I was getting into it again. I guess it is. All right. I guess that is the end of my slideshow. Ooh, that was pretty quick. Well, you know what? I'm happy that I started over. I did this class back in 2023. I have the date right here, and I'm happy I put the date because if I didn't, I wouldn't even know when I did this class. I did this class on September the 14th, 2023. These are what my classes are like. This is just a preview, okay? Now, if you ever want to come, if I do like a special class and you ever want to come to my class, they're $25. They're 2-hour classes. The first hour I teach, the second hour I juice. So say we're talking about the pelvic floor, like right now, right? The second hour, I'm going to bring out my professional juicer and I'm going to juice recipes. I'm going to show you a few recipes of juices you need to drink if you have a weak pelvic floor. Okay. So with all this information that I gathered and I studied about and I just shared with you, ladies and men, try to incorporate this into your life a little bit more. Okay. And the more you know, then the better you are, the better you can take care of yourself. All right. Nobody's going to take care of you like how you're going to take care of yourself. All right. Make sure y'all take care of y'all pelvic floor so it can be nice and strong. Okay. Um, and that you don't have problems with incontinence. Now, if you do, it's nothing to be ashamed of. Okay. Just like if you're in a relationship, you want to know if you have any health. That's a part of getting to know somebody, right? If you're dating, you want to ask questions like this. You want to ask questions like, besides like where you from, how many kids you got, have you been married before, from the standard questions. You want to ask questions. If you're looking for a partner in your life, you want to ask more critical questions. Do you have any health issues? You know what I'm saying? Can you still have kids? Just in case you want to have kids, you want to ask questions like that. Besides, like, do you go to church? What's your religion? If you have kids, do you visit your kids? How often do you see your kids? That's the mind frame you got to have when you're trying to get to know someone. And you got to give it time, which is the hardest part to do, because you can be attracted to someone, but you want that person to also be attracted to you in a way to where it's not just about your body, it's not just about how you look, it's not just about the things that's not really important. You really want to focus on, does this person have a good heart? Can I count on this person when I'm going through things? Can I talk to this person? Will they give me the attention that I need? Are they loving? Are they kind? Are they honest? It's a lot of questions that you need to ask. I know I'm getting off subject, but I'm just letting y'all know that I'm saying it just kind of ties together, okay? So you got to always ask the right questions. And like I said, especially as you get older, you want to know if whoever you're talking to have issues, okay? Very important. I've learned that recently. You got to know a person's history. You got to know, understand a person's history, okay? All right, y'all. So that's what I wanted to show y'all right now. So this class was about the pelvic floor. I hope y'all enjoyed it. If you do a recap on this video, let me know what you think. Okay, let me know what type of videos you want to see. I will be coming on here daily to talk about a topic. Besides me coming to sell my products, which I usually do that on Facebook, and then I'll, share the live here, or I'll be on 2 different phones, okay? All right. So if you enjoyed the live, tap, 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 tap the screen. Okay. I don't know if y'all can share this video. I don't know. Sheila, you still here? I don't know if you can share this video, but if you can share this video, please share this video with women that have issues, like feminine issues. Even if they don't have issues, everybody need to know about the pelvic floor. Okay, a lot of people may not even know what a pelvic floor is, but yes, every woman has a pelvic floor. All right. So very, very interesting topic. And I hope that y'all learned something and share the information with people that you love. Once again, if you are a subscriber, let me know where you're from. So let's see. I'm going to see the results. So we have 67% of you said you are from YouTube, and 30% of you said you're from Facebook. Okay, so that's my people that follow me already, right? So my goal is to increase the numbers on YouTube. I want to get a different set of people. I want to attract a different type of people interested in health. I want people that is interested in digital products. Okay, that's my niche. My niche is holistic health. Okay, so that's what I'm here for. So that's good to know that I have more people that was on YouTube that was watching. So that's really good. I'm gonna go ahead and end the poll, okay? And it should put the numbers of the votes and everything right here in the chat. All right. So again, my name is Yolanda. I'm from Houston, Texas. If you enjoyed, thank you so much for watching. Hope you learned something that you didn't know. If you want to support what I am doing, all you got to do is scroll up, go in the chat. You're going to see a link where it says Yo-Yo's Kitchen, Houston, Texas in yellow. Click on that link below. It's going to take you straight to where I sell my digital products, and that's where you can purchase. And make sure you download your free recipe of my recipe for inflammation, okay? Juicing recipe. All right, bye, y'all. Share this live.